Our next guest speaker is our very own Courtney Hanna. Some of you may have connected with her over the past number of years. She has been full-time staff at the Society in our programs and services area and was probably the main point of contact for a number of you in terms of information and referral. Courtney is a clinical, has her master's in counseling psychology, and so she provides clinical support in that area. Unfortunately, she was recruited away from us to do full-time counseling. However, on the fortunate side, her schedule allowed her to still give us 1 day a week. So Fridays, she does counseling at the Society. And if any of you are unaware of that service, you can access it. We're very fortunate to have a second person with the same counseling credentials. And so we do, that's Miriam Lepine Lyons, that some of you may have already connected with as well. So if you're not aware of that service, it is available. You just need to phone and we set up appointments. We are having to look at possibility of expanding it though, because right now we're booking into January. So it's something that we hear is very helpful to you, and you heard in Dr. Wild's presentation that the acceptance of the diagnosis right now is probably difficult for a number of you, and moving on, some of the transition issues and dealing with depression, anxiety, and apathy are all areas where a counselor can assist. So we're really thrilled to have Courtney with us today. She has a family connection to the disease as well, and so has developed quite an understanding and expertise of what somebody going through the journey is going to experience in addition to her professional training. So with no further ado, welcome, Courtney.
Thank you, Jean. I appreciate that. So yes, I do see a lot of familiar faces in this room, and it's been amazing to work with the Parkinson's Society, and I'm very fortunate to be there in a counselor role now on a part-time basis. So I'm going to be talking about adjusting to your diagnosis today. So just a bit of an overview. I'm going to be defining what adjustment and resilience means, looking at the stages of grief and loss. And then I'm going to break it up, and I'm going to have you participate in what I call a strengths exercise. It's going to be very brief, and it's a handwritten exercise, not physical. Followed by a bit of discussion on depression and anxiety and some coping skills and treatment for that. And then followed by a question and comment period. So what is adjustment? What does that mean? Well, it's our ability to accept and change when we are faced with a challenging situation. So like being diagnosed with Parkinson's. And what does resilience mean? Well, that's our ability to cope with the challenge. Up, didn't I? Oh no. Okay, sorry about that. It's our ability to cope with a challenging situation and to build upon our strengths, to protect us and to promote our well-being. So how are you all going to do that? You've all been faced with a fairly recent diagnosis, and how are you going to be able to not only be resilient and adjust, but to hopefully thrive again with this? Well, it's going to be different for all of you, but I think it's going to be really important for you to first understand where you are at. So where you are at in digesting this diagnosis. And that's what I'm hoping to bring some light to you today. So new diagnosis for most of you probably came as a complete shock, as Dr. Weil alluded to. For most of you, it probably came out of the blue, but I do have also some clients that say it came as somewhat of a relief. You know, they may have had some symptoms that they didn't really know what they were, or maybe they were misdiagnosed with something, and so sort of seeking an answer. So for some people, it may have come as somewhat of a relief to finally sort of have something to go off. But when we're faced with this kind of challenge, whether it was a shock or somewhat of a relief, it most likely came with some overwhelming emotions. So these kinds of emotions can likely lead to feelings of loss. So maybe it's loss of your identity, or loss of your health, or loss of what you thought your future might look like. And these feelings of loss can lead to the grieving process. So what is the grieving process? Well, that is going to be different for each and every one of you. There is no right way to go through these emotions, but I think what I can provide you with is maybe learning, as I said, to see where you're at today and trying to work toward accepting where that is, because once you can accept that, you can work toward moving forward. So what are the stages of grief and loss? There are 5 sort of typical stages. The first is denial, second is anger, the third is bargaining, and then depression and acceptance. So these stages, it's important to note that these are pretty general stages. Not everybody goes through these stages. It's rare that you won't go through any of the stages, but you may go through them in a different order. You may be sort of bouncing between some stages, so you may be feeling some denial, and then maybe jump to depression, and then maybe to anger, and so it's not sort of a set in stone way of going through things, but it is the most common progression through when we're dealing with a loss. So what is denial, the first stage? It's typically the first reaction to finding something out, like a diagnosis of Parkinson's. And it's often us wanting to deny the reality of our situation. It's a very normal reaction to overwhelming emotions. And it's often, denial's often our brain's way of, it's a defense mechanism that our brain uses to buffer us from the immediate shock of a diagnosis and the emotions that come with that. We're not ready to face it yet. And denial is often a temporary response, but it can be longer lasting for some people. So the next stage is the anger stage. Now, this is often when denial starts to wear off and reality of your emotional situation is kicking in. And often these emotions are quite painful, and they're very present still. So we may feel unprepared to deal with this reality and these emotions still, and so we often redirect these emotions as anger. And that can be anger or blame toward other people, like maybe the neurologist who diagnosed you, or anger toward family members or loved ones, or anger toward yourself. Rationally, we know that blame won't solve anything, but emotionally, we're just stuck in this feeling of anger and resentment, and those feelings can often lead to guilt and shame, which then just makes us feel angry. So you can see where it can lead to a vicious cycle here. So the next stage is bargaining, and this stage is often sparked by the need to regain control. So it's often an attempt for us to negotiate our painful situation away. We don't want to be dealing with what we're dealing with, so we might have persistent thoughts of, what could have been done to prevent the illness or the diagnosis. So maybe things like, if I only get a second opinion, maybe maybe it's not Parkinson's. I don't want it to be Parkinson's. Or if I were a better person, this never would have happened to me. Or often people make promises with a higher power, promises that they'll be good in return for, taking this pain away from them. So that's the bargaining stage. And then comes the depression stage. Now, some people may experience this when they do start to realize sort of the extent of their loss and what's going on for them. But they're no longer in denial. They're no longer feeling angry or trying to bargain. So they're not sort of suppressing their emotions that way. But their emotions start to take over. So feelings of maybe sadness or emptiness, a lack of interest or motivation in certain things. You may start isolating yourself or finding that you have a lack of energy or concentration. These are all symptoms that are in the depression stage. But it is important to note here, and Dr. Weil spoke of it as well, that depression in Parkinson's goes beyond simply being a stage in the grief and loss process. It is a mechanism of the disease as well, and I will touch on that a little bit further in the presentation. So the final stage here is acceptance, and this is coming to terms with the various emotions that you've been struggling with, and starting to accept that the diagnosis has occurred for you. And healing can begin when you start to integrate the diagnosis into your life experience, and start to really adapt to it. Then you can move forward from there. And I wanted to share a little story here, I guess. There's a gentleman named Kelly Jablonski, and he's a huge supporter of the Parkinson's Society, but he's also an incredibly inspiring man. He has presented at some of our conferences, and he survived a deadly plane crash. You may recall it. It was in Richmond, I believe, in 2011, just outside. It was a little fighter jet, I think maybe 12 people aboard, and he survived it and walked away, injured from head to toe, completely injured. But not only did he recover, but within 3 to 4 months, he was training for a very, very long bike ride across Europe. So he was thriving again. And something that was so poignant that struck me, he once said that what allowed him to move forward was realizing that his accident and his injury, it did not change the course of his life. It was the course of his life. So there's a very subtle difference there, but I think the same goes for all of you here today. This diagnosis, it didn't change the course of your life. It didn't, throw off your plans or make you go down a different path. It is the path and the course of your life. And like I said, there's a very subtle difference between the two, but I think if you can learn to grasp that, then you can learn to start moving yourself forward and stop feeling stuck if you are feeling that way. Also, if you're interested in seeing any of his speeches, they are on our website, I believe, yeah. So, accepting change. Well, staying stuck in the past, like I said, or focusing on what your life used to be, always comparing what you used to do versus now, that will likely leave you stuck in one of the more beginning stages of grief and loss. So maybe bargaining, like, I don't believe I have this, or not wanting to, in denial, that kind of thing. And it really will prevent you from accepting this change in your life and trying to live well with this change in your life. So the best way to do this is trying to adjust and trying to cope with what's going on, and setting up new life goals and new life expectations that can fit in for you. So what does that look like? Well, when we are faced with a change or a stressful situation that this diagnosis likely was for you, we often have two avenues or two responses that we can make, and that's changing the situation or changing your reaction to the situation. So if we were to change your situation, that would involve avoiding or altering the situation. And it's not likely that you're going to be able to alter the fact that you've been diagnosed. Maybe for some of you, if you're in that bargaining or denial stage. But it's here, and avoiding it also won't work for you. So changing your situation isn't really an option. But what is, and what I can recommend you focus on, is changing how you are reacting to this situation, and that can be done through trying to accept and trying to adapt to it. So, how can you accept it? Well, sharing your feelings is a start. Sharing your emotions and getting out how you're feeling. Not only will that allow you to really dig deep and recognize what's going on for you rather than suppressing all of it, it will sort of alleviate some of it, because getting that energy out is really, really healthy and therapeutic. Learning to forgive, adapting healthy lifestyles like diet. We know a Mediterranean diet is very healthy. Getting in exercise, that's so important. Seeking some support. And trying to get good sleep, as much as I know that's there's a lot more to it in some people with Parkinson's. And maybe one of the most important is, don't try to control the uncontrollable. Now, I know this is easier said than done, but we are so, as a human species, I'm guilty of it as well, we're so worried about what's going to happen in the future, and we're so, we think about and regret what happened in the past, and then we worry about what's happening in the future, and we can't change the past, and we have no control over the future, zero. So, like I said, I know it's easier said than done, but that's just going to add to your stress. So worrying about tomorrow and worrying about what's going to happen, and none of us know that, diagnosis or no diagnosis, we don't know what's going to happen tomorrow. So recognizing when you're doing that, and recognizing that it's not going to help you and it's just going to add to your stress level, and trying to sort of reel yourself in and saying, okay, I know I can't control tomorrow. As much as I want to worry about it, I can't. So trying to live in the moment, and trying to ground yourself in the present time is going to be the easiest way to cope. Again, it's easier said than done, but if you can try and do that, I think it will be very beneficial for you in moving forward. And so how can you adapt? Well, things like reframing your thoughts. We have so many thoughts going through our mind all day, every day, and they're just that. They're not necessarily true. Most of the time, they're not true. So we have a tendency to believe everything we're thinking. Well, it's just our perception of things. So sometimes it might be true, but oftentimes it's not. So when we get stuck in maybe a negative spiral, trying to recognize that it's negative and it's not necessarily true, and trying to reframe that. Sometimes we can get stuck in thoughts, and it really limits us and limits our belief system, and it can keep us stuck in certain areas. So really trying to recognize your thoughts so that you can move forward. Turning fear of the unknown into curiosity. Trying to adjust some of your expectations. That's a big one. And taking a proactive and positive stance to your diagnosis and to the treatment for your diagnosis. So many neurologists actually have reported that symptom deterioration is significantly lower for people who take a positive and proactive stance to their diagnosis and their treatment. So basically, they do better, the people who are positive and proactive. So I just want to point out that all of you, to me, represent that you are being proactive. You're all here, you're all learning and curious and wanting to educate yourselves further about what's going on for you. So that's a really good thing to see. So now I want to do a little exercise that I mentioned with you. You should all, under your the agenda on your table, have a blank piece of paper, or it has our logo on it. But there's a blank piece of paper somewhere in front of you, I believe. No? Yes? Yes? Regardless, if you have some piece of paper, it's just going to be a few little things I'd like you to jot down. And you should have pens with you as well. So I want you to take a moment and I want you to think of a challenging situation before your diagnosis. So not with respect to your Parkinson's diagnosis, but I want you to think back to a challenging situation that you got through. And I want you to jot down a few ways that you were able to do that. I would like to see you jot down 2 to 3 things, but as many as you can. And it could be things like seeking support. Maybe you got really organized and you made to-do lists. Maybe you reconnected with nature, or things like that. So just take a few moments and write that down, please. Okay, so I just want to point out that almost every single one of you were able to do that immediately. So we've all been through challenging situations in our past, and you've all gotten through it. You're all sitting here today. So some of the things that you've written down, these were things that helped you cope and get through things in the past, and they're things that you can most likely call on now to help you get through this challenging situation. And just like I said, reminding yourself that you've always gotten through things in the past and that you will get through this. You know, as hard as it can be to believe at sometimes, just relying on the knowledge that you know you've gotten through things in the past can be really comforting. So these are your coping strategies. Some of them may be different than what they might be now, but you were able to use some back then, so you can definitely find some ways to manage now. So now back to a bit on depression and anxiety that I had mentioned earlier in the grief and loss process. So approximately 50% of people with Parkinson's will experience some mood changes, so things like depression and anxiety. Oftentimes, these are even noticed before any motor symptoms are noticed. So maybe even pre-diagnosis, you've noticed some depression or anxiety. And that's sort of for 2 reasons here. So it is twofold in Parkinson's. On the one hand, it's a pretty reasonable psychological reaction, you know, feeling down and anxious because you've just been diagnosed with Parkinson's disease is pretty normal. But it actually goes further than that, and as Dr. Weil touched on a bit, it's actually a clinical symptom in and of itself. So due to the changes in the brain's chemistry, so the lack of dopamine and all of that, that is actually causing changes in your brain's chemistry. So that can lead to mood symptoms of depression and anxiety, just like it can lead to motor symptoms of tremor and rigidity. I hope that's clear. So what is depression? Well, it's a term that's used very loosely nowadays in our society. It is much more than simply feeling, you know, sad or blue. It's often characterized by persistent sadness or emptiness, a lack of interest to do really anything, along with several other symptoms like, you know, excessive fatigue, sleep changes in weight, changes in appetite. There are a lot of different things that are at play for clinical depression. And it also impacts you in various areas of your life. So it may impact you socially or occupationally or maybe educationally. So it's a lot bigger than simply saying, oh, I'm depressed. There's a lot more going on there. And so what is anxiety? Well, anxiety is an alarm system in our body. It's our body's response to threat. And that threat can be either real or perceived. So bear with me here, it's a little complex, but our body has a natural response to anxiety and to threat. Over millions of years ago, the way we survived as a species was to be able to fight off threats that we're, compromising our survival. So picture us as cave people millions of years ago, and we needed to fight, let's say, a lion that was in front of us. Our body would gear itself up to be able to either fight that lion or run away from that lion. And that's where you get the fight or flight response. So you can either fight or flee, flight, run away. So our body increases its energy, it increases our heart rate, it increases our blood pressure, increases stress hormones in our brain like adrenaline and cortisol, all in preparation to be able to have that energy to fight or run away. So fast forward millions of years to present day, it's not likely that we're fighting any lions nowadays, maybe not. But we do have a lot of threats, or what's also known as stressors in our life. Things like being diagnosed, other things like dealing with, even a lot of traffic can cause some anxiety, financial issues, having a family, there's lots of things. And stress can be positive as well. It can be positive or negative. That's a whole other talk. But anyhow, I hope you're following me, and that our body gears itself up to be able to deal with this, and our body has evolved to respond this way. So nowadays, you'll notice if you're getting anxious or feeling panicky, your chest starts to raise, you're feeling warm, because all of your body is responding the same way it did. And the only way to counteract that response is by doing or inducing a relaxation response. So the easiest way to do that is through deep belly breathing. So I know it sounds kind of silly, and when I started to get into learning about all this, I was kind of like, oh, that sounds so hokey, deep belly breathing. It's not really going to do anything for me, but it's incredible how much it works, and there's tons and tons of research that backs it up, and it's really simple because you can do it anywhere, and it's the only thing, like I said, that counteracts the stress response. So it actually lowers your blood pressure and lowers your heart rate, lowers the stress hormones firing in your brain, and it's kind of takes some time to learn, but all it really is breathing, and instead of breathing into our chest, which is what we do all day, every day, it's breathing and picturing that breath going deep into your stomach, so into your diaphragm, and then releasing it, and continually doing that. And you might even get a bit yawny when you do it because the oxygen is going into your brain differently. So that's probably one of the biggest strategies for coping, as I say here. So relaxation, deep diaphragmatic breathing. And I'll give you one tip if you want to practice this at home. I often get clients to put one hand on their chest and one hand on their belly and take a regular deep breath in. And most of them breathe, and they'll notice their chest goes up and down. And then I want them to try and do it and picture, keeping your chest very still, breathing deep into your stomach. So pushing your stomach out and in. It takes some practice, but the more you can practice it, it's like an exercise. The more you can practice and build that strength and that muscle, the more you become comfortable with it, so that when you are feeling anxious or having a panic attack or feeling all these sensations, you can implement that strategy that you're very comfortable with now, and it immediately will lower that anxious feeling, and it will really, really stop that really heightened feeling of anxiety a lot quicker than it would have if you didn't. And then reminding yourself again, when you are getting into these phases, that you're going to be okay, you're going to be safe. You really have to talk to yourself. Journaling can be a huge strategy for coping. So writing down your thoughts and your behaviors, and maybe examining how, if you make any changes to your thoughts or your behaviors, do you have a different outcome? It can be really, really helpful. Thought challenging, I touched this a bit earlier when I said reframing your thoughts. but we often can get into negative self-talk. So I'm never going to be the same, or my life is over, or, things like that. But, like I said, these are all thoughts that we create. So if we can recognize that we're being negative and that it's not helping us, then we can hopefully stop that. Now, it's not easy. I'm not saying it's easy, but it can be done, and it can be very effective. And even just stopping the negative thought, so I'm not saying, replacing it with fuzzy peaches and rainbows, because I know that it's not always that way, but even just the matter of stopping the negative thought and recognizing it and maybe naming it will lower its intensity. There's lots of research that shows this as well. Again, exercise, it's huge, boosts the dopamine in your brain naturally, and can maybe slow the progression, so that can really help with things like depression and anxiety as well. And laughter goes a long way. I was gonna use a joke here, and then I said maybe I shouldn't, but I saw how you all laughed at Dr. Weil's joke, so I'm gonna take a stab at one. So Jean mentioned that I have a personal connection. My dad actually has Parkinson's, but he's always been a really funny guy, and he still is a really funny guy. And he always says that he can make a mean martini, shaken, not stirred. That's my joke. So just a little bit more formal treatment options here. And again, I put exercise at the very top because I'm trying to hone in how important it is for all of you. And a lot of studies show that exercise is actually more effective than antidepressants sometimes. So it's really important to get into that. Medication, so I'm talking about medications that are specifically geared for the treatment of depression and anxiety. We talked about it a bit here, but if you are thinking of that, I think it's really important to speak with your doctors and your neurologists. And I think you can't have medication be the only line of treatment for this. If you're taking medication, that's great. That's one form of treatment, but you should also be seeking other forms, so exercise and counseling. That was a good plug, wasn't it? So, speak to a counselor, a psychologist, or a social worker about ways you can cope. Everyone's different here, so my talk is just going to be general. I'm not going to be able to get to each and every one of your needs, but it's really important to seek some support. Educating yourself. You're all here. Going to a support group. We have tons of support groups throughout the province that can help you. And looking into other rehabilitative therapies, so getting a handle on other things, like maybe seeing a speech-language pathologist to deal with some of your symptoms, or a physiotherapist, or getting an occupational therapist. All of these things will enable you to be more proactive and can help with some anxiety and depression as well. So we've been talking about exercise, and when you're depressed or anxious, how the heck are you going to feel like exercising? Motivation's really tough, and it's not easy. So I can give you a few tips. So starting small and setting realistic goals. So a goal like just getting yourself to the gym might be huge for you, but setting that goal rather than saying, well, I got to go to the gym and I got to do 45 minutes on the treadmill and then I have to stretch and then, well, I don't want to see those people at the gym and I don't know what I'm going to wear. And, maybe it doesn't go that way. Maybe it goes that way for me anyway. But you can understand what I'm saying is just getting yourself to the gym. Often once you're there, you will be encouraged to go a little further and to continue. And we all know that finding a buddy or joining a group can be really good for, having a little bit of, what's the word I'm looking for here? Somebody that you can just, be, what's the word I'm looking for? I can't, motivated? No, that's not the word. Anyway. Peer pressure works. That's not the word, but sorry, having a brain slip up. Anyway, to summarize today, how can you adjust to your diagnosis? There's lots of ways. Educating yourself is huge. So knowing where you're at, maybe what stage you are in, maybe knowing if you are stuck at all and how you can move forward. What are your treatments? Knowing the coping strategies that work for you and implementing them. learning to adjust and to accept things. Seeking support. The Parkinson's Society is an incredible support system that you have here. Almost all of our programs are free and incredible. So really utilizing that, seeing a counselor, talking to friends and family, and finally learning to be positive and proactive. And that is all from me. Actually, I just wanted to leave you with this. I wanted you all to remind yourself that you are still you, and that your diagnosis does not define you. I think that's huge. You're still, a son or a daughter, maybe a colleague, maybe a mother or a father. There's so much more to you, and I know that it's quite overwhelming, but it's just one piece of who you are. Thank you so much. Any questions or comments?